Winfred Nabatanzi is my name, Senior Orthopedic Officer working with Gulu Regional Referral Hospital. We're here today to talk about Clubfoot and our experience managing Clubfoot within Acholi sub-region. It has been a good experience, though with a lot of challenges from the communities, a lot of myths we have encountered among our people as we manage Clubfoot. One of them being the so-called joke, the one they always attribute Clubfoot to. So we have engaged with a number of parents. Just even right now, we had one who was having a challenge. The grandmother is always removing the shoes during the time the child is supposed to be putting. So a lot of challenges, but we are happy that our communities are willing to change and have a positive response to our management. Thank you so much.
My name is Acholi, one of the orthopedic officer treating Clubfoot in Northern Uganda, specifically Gulu Regional Referral and Acholi sub-region. I'm a coordinator for delayed presenting Clubfoot. So Clubfoot is a treatable, can be treated and for free. So I encourage parents, those and the communities they're having children born with to adolescent oral Clubfoot to bring the children to the hospital, Gulu Regional Referral, Kalongo, Dr. Ambrosoli, Oral General Referral, whenever you're within Acholi sub-region. So it is not about a curse. Clubfoot is not about the curse the child is born with, and it can be corrected. Can be treated very fast if the child is brought at an early stage. But if you delay, it will be difficult to treat. From 2 years and above, it will be difficult to treat because the tissues in the foot are already grown up, and it is a time demanding. So start early, bring the child to the hospital, and then we start the treatment early. It is free of charge. You are not asked for anything, to buy anything, but everything is available. Thank you so much. I encourage you, whenever you see a neighbor with a child having a Clubfoot, talk to them and bring them to the hospital. We can sort it out. Thank you.
Mutumulane Hilary, alias Komagum, orthopedic officer in Gulu Regional Referral Hospital. In Gulu Regional Referral Hospital, we serve clients from Amuru District, Chitugumu, Kalongo, and within Agago, Omoro, and Ramo. I will talk more about the challenges our clients face and with the service providers. One of the challenges is transport, because our clients sometimes they abscond, they come to the clinic, and one of the challenges they present is they travel longer distances. Another is the myth in the community, whereby people think here still Clubfoot, it is like a curse which God gave you, so it is a punishment. So in being so, when you collect Clubfoot, you get more problems. So solving those issues, we need community sensitization through the church leaders, traditional leaders, all cultural leaders, and political leaders in the community. We need their will, such that the people can understand this is not a thing which is going to be stopped in one day, to keep coming. So we need all their input. We need more sensitization, maybe through radio stations, and then moving to the villages, such that people can know that Clubfoot is treatable and it cures.
My name is Nixon Ayusuge, orthopedic officer at Gulu Regional Referral Hospital and the treatment provider for Clubfoot. Briefly, I will tell you about how Clubfoot is treated and how the steps are supposed to be followed. Clubfoot treated in two stages. First stage is the correction stage, and then the next one is maintaining phase. A child comes to hospital. The first stage is we collect the feet. We don't cut the feet, we just collect them manually by pulling and relaxing them until they go into a corrected form. Collecting, then we tie POP guana, which usually changed every week until the feet are collected. Usually around 4 to 6 weeks, child is treated as a go home patient. Come, we treat you, you go back home, you don't need an admission. Later stage, the child may need to get some small operation, which is also done, and then they go back home. After the feet have been collected, feet have a tendency of going back to the stage where they were not treated. So we usually support the feet with the shoes that keep them opposite so that they don't go back. And the child has to wear those shoes as guided by the health provider. And usually they have to wear those shoes until their 5th birthday. The challenge is when the feet are collected, parents tend to relax and they stop putting on the shoes and the feet tend to go back, relapse. So we encourage all the parents that when the feet are collected, please maintain the shoes as they are being told, and the children will have better feet, enjoy life, put on good shoes, play football, and enjoy life. Thank you so much.
My name is Henry Musoke. I coordinate the activities of the National Clubfoot program in Uganda, which is an umbrella coordinating the providers in the region to the country to ensure that clubfoot care is given to every child born with clubfoot. We are aiming at having all the children born with clubfoot treated before their first birthday, that is before they are 1 year of age, and to ensure that clubfoot is integrated within the maternal and child health activities in all hospitals. On this day is a special day. I came for support supervision of the clinic and mentorship, and we are glad to be with the team in Gulu Regional Referral Hospital treating clubfoot and the mothers who have come to bring their children for follow-up. At the same time, commemorating the World Clubfoot Day that usually lands on the 3rd of June, which is a public holiday in Uganda. Clubfoot in Uganda and world as large, we are using the Ponseti Method of treatment. And that's why we have the World Clubfoot Day commemoration, because this method was invented by the late Professor Ignacio Ponseti, who was based in Iowa, and has given us excellent results in most of the patients we have treated. We are glad that the country and the Ministry of Health took on this initiative of treating clubfoot using Ponseti Method, and we want to call upon every parent, every community member who knows where the child with clubfoot is, to send them to the facilities. In the Acholi sub-region, as Patricia said, we have the treatment at Gulu Regional Referral Hospital every Thursday, free of charge. Wednesday, we have in Gulu General Hospital, and Friday, we have in the Dr. Ambrosori Memorial Hospital in Kalongo. Please send your children to get free treatment and live a better life. Ponseti guarantees a functional foot, pain-free, and shoeable foot. Why should we get special shoes for our children's feet? Yet we can get treatment and they get better feet. We call upon you to send your children as early as possible. Thank you.